Well, there are reports that the COVID-19 strain currently ravaging India has been found in Nigeria. The strain was detected by the African Center of Excellence for Genomics of Infectious Diseases and has been communicated to the Nigeria Center for Disease Control. Now, the detection of the Indian strain in Nigeria contributed to the fresh regulations issued by the federal government. How can Nigeria ensure that the COVID-19 pandemic does not once again spiral out of control? That's the big question. And joining me to discuss this and possibly answer that question is public health specialist Tui Mebaundu. Good morning. Thank you for joining us on TVC Breakfast.
Thank you for having me.
Now, there are concerns. Seeing what is happening in India and Nigeria now being confirmed to have that strain in 2 states is generating concerns that how can we ensure that this does not spiral out of control? I wonder what concerns you have, first of all.
It's a serious concern because, again, the strain detected in October in India, in 49 countries, at least Africa is having quite a sizable number, Kenya, Uganda, Nigeria, Senegal, Gambia. So we're seeing the strain also in Africa. Now, Nigeria, 2 states, Edo and Osun, they're having the cases. But what we need to do exactly is, because you see, it's a variant of concern, you know, it's a variant of international health concern because it has been established that it leads to increased spread of and actually cause more severe diseases, okay? And then some of the vaccines can actually escape, will not actually, you know, be working against that strain. So those are the 3 challenges: more spread to people, then more severe illness, and of course, the likelihood that the vaccine may not have effect on that.
Because we see what's happening in India. The vaccine is not seemingly addressing this
sufficiently.
Yes.
Okay, so now for us, what do we need to do? Well, the government is actually doing their own border surveillance. Okay, that means that people coming from India, what do we do to them? People coming from those countries of concern, what are we doing to them? But more importantly, we need to really firm up our national genomic surveillance. Because you see, these are genomes of the mutant strain of the virus. If you don't do your surveillance and check, you won't know whether you're having either South Africa variants or Indian variants or any variant for that matter. So we need to increase that. So the capacity of the laboratory has to actually be firmed up. Very key at the level of, so people that need to do that, okay, thank God EDA is providing services for us now. But we also need more states and more centers to be able to do that and check what we call the national genomic surveillance of the strain that is available in Nigeria. But why at that? We must not stop re-emphasizing the importance of personal protection, non-pharmaceutical protection, okay? This is not the time to lower your guard. This is not the time to be saying, okay, you know what, I'm covered by whatever. Yes, good, you are covered by whatever, but please, you know, for the sake of other people, embrace those protocols. Run away from crowd, ensure you cover your nose, wash your hand, and don't allow this thing to spiral out of control because, again, we don't have that kind of resources to deal with a spiral case or another wave of COVID in Nigeria.
And that's the concern for a lot of persons because we saw the response of Nigerians to the protocols in place. And even when the government, you know, reminded us, because the government says it is just a way of reminding us that these protocols are still very much in place. And it's not like it's a new protocol, so to speak, except for the border control and ensuring essential travel that they have said it's quite new this time around. How do we begin to ensure that people take responsibility for their safety? Because this is a personal thing. And because another issue is leadership, which has also been a major concern. Is it because Nigerians are seemingly not seeing the kind of leadership required to drive enforcement, to drive our plans towards ensuring that we bring an end to COVID-19 in Nigeria, that we are seemingly having that challenge? Because that's what we get from most of the guests that we have had here?
A combination of a lot of things. But again, even if you look at Nigeria, quite a lot of things is happening in the country presently. It has come to the point that people must take responsibility. Right. And not, again, yes, you want to look at leadership. Let's get it straight from the beginning. We can't get hold of the information management in the public space. And then, of course, everything filtered in. Everybody has their own opinion. Some traditional leaders have cure for COVID. Some, religious leaders have their own cure for COVID. And then we seem not to be grasping the information management properly. That has caused a huge gap. Now, what we need to do is to come back again and try to appeal to individual at individual level. So unless we can then start to act individually, if we can get support from the local community, that would be nice, that would be wonderful.
But we have been saying this thing from the beginning.
What you keep talking, even from the religious perspective, they said faith cometh by hearing and hearing. It's a present continuous, They have to hear and hear and hear and hear. Again, so what we need to do is to actually look at our information management in this regard. I agree that there are issues concerning how the leadership has been really driving the case. But how do we manage our information in this space now? So information is the cheapest thing we can deploy to let people understand that we are not free from COVID. Now, again, we have to actually look at where is the international support? At the level of WHO, because, again, they have also mismanaged the case from the beginning. They delayed in declaring this thing as
a pandemic.
Public health, as a pandemic, they delayed. Then secondly, we must be able to allow each country that gave rise to a pandemic to be more accountable in terms of that payment, that punishment, to be more accountable. We must also allow WHO to declare any pandemic without the permission of the country. And then we're having challenges with these vaccines now. It has to be an issue of conscience for every developed country to say that, listen, if we're having this variant in 6 regional organization of WHO, but all everywhere, the 6 regional zones of the WHO is divided into, we're having this variant there. It becomes a conscience on the heart of every country, every developed country that has access to vaccine, to ensure that this thing is deployed to the people as soon as possible and spread across. It's not for people holding vaccine and some people feeling that, listen, I have double dose for my country, and then you now act as if you are not part of the global community. But
it's in a way telling you that you shouldn't be waiting for hand-downs, if I may use that word.
This is a pandemic. Listen, if you get handouts, take it. This is a pandemic. Right. Because, you see, people tend to compare this thing with, say, malaria and COVID. They're not the same thing. A disease that comes, shut down economy, did all these things, killed this number of people, more than 3 million people worldwide, more than 125,000 in Africa, still going and, having flares and mutant strain. You don't want to compare that to malaria. You don't want to compare that to malaria. The devastating effect is massive, even on individuals. So what we need to do is at our level, act locally, act at your level. Let's direct the information to individual now. Let's direct information to tiny community. We cannot have overdose of information, at least good information, with this regard, because every day you are seeing new people coming up, new theories coming up, new conspiracy coming up. Government must be at the top point of addressing those things and knocking those so that we can get the right bang for the bucks in everything we're doing. It is important. Without that information, which is cheapest as far as I'm concerned, what are you going to do
now? They keep telling us that information is already out there. So what more do we want from them to put out?
You see, for the 2 dominant religions in Nigeria, information that, God loves you has been on for how many years? For thousands of years. Keep talking until we get there. If you keep quiet, you reaffirm the doubters. You reaffirm the hesitant, the people that are hesitant as far as vaccine is concerned. You keep talking, you keep bringing out information. Look at, we've seen what's happening in India. India declared victory over pandemic prematurely. And they opened the religious centers, they opened the political center, and look what they have now. Bring that to dwell on Nigeria. You saw people in India destroying their gods. Bring that to dwell on Nigeria, that listen, this is what's happening in India. Are you different? You see what is happening in Brazil and Chile. Bring that to dwell on Nigerians. There are copious examples that you can bring. You see, Africa has been lucky. We don't know why yet. It's not prayer, let's face it. We don't know why Africa has been lucky. But we cannot stretch our luck too much. I mean, that would be suicidal. So if we're lucky, let's maximize this luck that we have for now and then be able to curtail the spread of this virus you know, in Africa. And by taking personal responsibility, by acting at the community level, by keep talking about it. It's not that one wants to come here and be speaking the same thing, but who knows? Perhaps today somebody will understand what I'm talking about.
Absolutely.
Perhaps tomorrow another person will understand. That's how you spread good information. So you must be able to counter negative narrations in the public space. If you don't do that, you mess up your whole campaign. And at the end of the day, a broken health system, a minority population, and poverty will interact to cause more instability in the country. Health is a component of stability of a country and development. We don't want to have the scenario of India on our hands, maybe on the street of Abuja or Lagos or Port Harcourt. It's not going to all go well. So honestly, we just have to keep talking about it. Sometimes we need to sit down and reassess our information. Why is it not having impact? We need to address that critically. Why is it not having impact? Once we can get that done, I can tell you that...
Why do you think it's not having the needed impact, from your point of view?
Complex. We lost the steam from beginning. Secondly, leadership issue, trust issue with the leadership. Thirdly, you know, the role of religious organizations in actually spreading the conspiracy theories, okay? Because what has happened is that people's intellectual, you know, has taken flight. And you know, what is faith without work? I mean, I don't understand. So, but me, I'm not going to start dwelling on your belief or not your belief. It's up to you. But again, know that if you have a mother, if you have a son, if you have a daughter, if you have people that you are responsible to, you have the right to keep yourself alive.
I mean, I saw a tweet from a lady, an Indian lady yesterday, who says that while she was tweeting, her hands were shaking, that she just lost her parents to the new strain. Yeah,
you see what we're talking about. You know the impact of that on that lady. You know, because you see, for instance, you know, if you have a challenging health system,
right,
it can turn a family that is actually an average family to poverty if they lose their breadwinner. Who is going to send the children to school in a country like this? Who is going to provide, you know, for your loved ones? Stay alive. You don't need to be in a hurry to go to heaven now. Maybe you stay there forever. Why are you in a hurry to go?
Right. Thank you so much, public health specialist Uimi Baudu, for your time on the program.
My pleasure always.